Thanks so much for joining me on the podcast. How are you today?
I am good, Jared. How are you?
Doing well. Excited to have you here. Would love if you could kick things off for our audience and just telling them a little bit about your background and then a quick overview of Heartbeat Health.
Yeah, absolutely. My name is Jeff Wessler. I'm the CEO and founder of Heartbeat Health. We're a virtual cardiology company. So think of that like a cardiology practice in the cloud. We do care. So we're a care delivery organization with cardiologists and clinicians across a pretty broad spectrum that provide care for patients with cardiovascular diseases. We're a telehealth practice in all 50 states now, pretty large volume, and primarily doing care for risk-bearing organizations and value-based care orgs.
Since you started the company, what would you say was one of the best times and maybe one of the more difficult times?
Yeah, it's all been perfect all the time. We've never had any difficult times. I wish that were true. We're 8 years in now, so we've been through a lot of ups and downs. Have had distinctly three or four real business pivots and changes in directions. I'd say those are the hardest times. You invest so much into a direction that you have convinced yourself is the right one, and then you have to take a hard look in the mirror and say, despite my conviction, massive conviction that we were doing something right, we now have to admit it was wrong and go down a different pathway and then get a bunch of teammates and people to agree with that new plan. So that takes, I think, a level of uh, self-reflection and humility that's really difficult. And I've now, I've had to do that a few times. The counter to that is when things are going well, two things. I've had two consistent feelings during good times. Number one, and probably most important for us, patient stories are flooding in with people who are appreciative for the care you do. And I think that's something fairly unique to healthcare is you can count wins by patient success stories. And when you feel that, it you thrive on it. It makes you feel good. It makes your team feel good. It shows that you're doing something really helpful, and it helps encourage the direction you're going. And then the other is Heartbeat is a B2B organization, so we work for other partners and provider groups. And when those groups double down and add services and grow with you, it really shows that this is a value added layer of care we're bringing on, and that's incredibly rewarding and helps again sustain us moving forward.
So when you first started the company, you said 8 years ago now, what did you think the model was going to be?
Yeah. So here's what I knew back then, and pretty much the only thing I knew that has proved to be right. Uh, that access to specialty care was going to become a decades-long challenge in this country. Cardiology would be front and center of that, but all specialty care models we're gonna suffer. So when we set out, the goal was really to solve the access problem, make it easier for people who needed cardiac care to get to the cardiologist at the right time. When is that right time? Well, it's not when they have a heart attack. It's before that heart attack happens. It's before that stroke happens, heart failure, arrhythmias like AFib. So we set out and built this model to say, let's make it easier to get to high quality cardiology care. We initially had a brick and mortar office. It was in Columbus Circle in New York City, where people would come in, and we employed enough modern touches and technology to make it a pretty seamless, easy experience. You could get all your testing in one go. You didn't have to come back and forth to the office 10 different times. And we used telemedicine and text messaging, which back then was pretty innovative in healthcare, to interact with patients. Um, Things were going pretty well, but we weren't really doing all that good. I sort of say lovingly, we were seeing Upper West Side yoga moms and dads who loved to try new healthcare trends and fads, but we weren't seeing people who had real cardiovascular illness and burden where we were going to make a clear dent or inflection point in their disease trajectory. So that was the impetus for the first big change we made to say we've got to target populations that really need our care model, not those who want to try a a new healthcare trend.
I think the best founders go through this, right, where they have to have one or multiple pivots. I've never met, I mean, I've been just through these interviews, but then just also through the network. I have not met many founders that are like, yeah, we nailed it. First time, model was right. Like the idea, like it seems like the best are able to pivot and pivot, maybe even more than once. Um, that's hard though, like you said, because you have such conviction in what you're doing. And most of them that I talk with said we pivoted because that's what was needed, but I still strongly believe that that was still the right. You wouldn't have been doing it right if you didn't think that was the initial right path. what what do the early days look like when those type of pivots happen? That's something I would love to kind of hear from your point of view. You don't have to give us like anything that's secretive or anything like that,
Yeah.
but would love to hear like when that pivot happens, what is really the first step of realizing, okay, we have to shift a little bit? What's step one?
Yeah. So I think there are clear transitional points in an early stage company. So those involve uh, team. You have to decide who and how to bring on new team members. It often involves financing. You have to make big decisions about if and when to bring on capital and what to use that capital for. So those are actually good, having big decision points, because what it forces you to do, the easiest thing to do, and often a, a mistaken thing to do, is just to be heads down building incrementally, because it's easy to increment your way, um, you know, off a 30,000-foot cliff. So I think there are these forcing functions in the early stages of company where you have to take a step back and say, I need to think through the next year or two and what this is going to look like. And what's ironic is that's often how things start. When founders start companies, they think about the 2, 5, 10-year journey. But then the second that they're down, they start building and they're actually getting to work building a product, it's easy to lose sight of that bigger journey. So um, the first stage of a pivot often happens when you are taking your first like broad look back at what you've done and where you're going over the next few years. And for us, that was, look, we're growing reasonably fast. It wasn't hockey stick fast, but we grew a reasonably big practice model in New York because we had this nice modern healthcare experience, but we weren't doing much good for cardiovascular illness or disease, and that that was gnawing at me. And so when we went to raise, it was I think a financing that was going to set us up for our next stage of growth. I said, it's not. I don't want to build this big consumer brand that um, changes slightly the cardiac experience. What I want is to change the disease trajectory of cardiovascular illness. So we have to totally refocus which patients we're going after and how to do that.
When you look at the future of your space, it's tough to always predict, right, what's next. And obviously, um, AI has impacted every space. We don't have to talk too much about that. It seems like I enjoy talking about it, but it seems like that's all that we talk about now. Um, what do you think the future looks like for your particular space in heartbeat health?
I always like talking about AI because as a cardiologist, AI has a different meaning, which is aortic insufficiency, which is a valvular disease. So I get to sidestep having those real AI conversations. Um, the future for cardiology is, I really believe, drastically changing. We, as a field, if you compare cardiology to other conditions and specialties out there, we have a rich data set of actually studying and bringing evidence to the table to bring new treatments and therapeutics and diagnostics that is probably decades advanced of what the current practice is. And that's one of the things that always excited me about uh, cardiology is just how advanced we were with bringing new things to the table. Um, the next wave of this is going to be implementation. How do we actually get them to the right people in the numbers that we need to? And the easiest example of this is um, standard of care for things like heart failure are at 10 to 15% penetration of where they should be. We have all these amazing medications that treat heart failure, which is one of the top cost burdens in the country, and yet only 10, 15% of people get those. Like that's a massive, massive opportunity not to develop new treatments, but to just implement them, get them to people. So I think that the future of cardiology is heavily tilted toward implementation science and getting the care we know that works to the masses of people who will benefit from it.
What blockers still exist that you continue to keep an eye on and you hope maybe go away over the next couple of years?
I'll start with the pharmaceuticals. So uh, drug therapy works really well for cardiology. Um, Treatment for high blood pressure, hypertension, for high cholesterol, hyperlipidemia is amazing. Anyone who has high blood pressure and cholesterol should be treated back to normal levels and basically reduce their risks down to negligible amounts. And yet, if you think step by step about the what keeps people from getting those meds, it's like there are 10 blockers in there. It's the meds can be expensive. Various insurance plans have different formularies for what is covered and what's not covered. Uh, uh, Picking up the meds through the pharmacy can be frustrating. These are often lifetime meds, so getting them refilled again and again and again is a clear friction point. Uh, Adherence is a huge friction point. Who wants to take a med every day, let alone twice a day, sometimes 3 times a day for the rest of your life? Um, the side effects, there are side effects for some of these meds. They interact with other meds that will come and go with big importance. So it's just this collective like chopping away at an ice block of little things that can go wrong that prevent us from getting the that magical 100% adherence that we would really need to see the effect of these.
You've been doing this for 8 years. What do you love most about it still?
Um, I was reflecting on this earlier today, actually, I was talking to an early founder. I love the day to day. I love. I wake up every day. I look forward to my days. I like the variety of uh, who I'm meeting with, what I'm doing every minute. Uh, and then two things I think drive me on the longer horizons rather than the day to day. Number one is impact. And I think I love being a founder, but I don't think I would be a founder of a widget company that wasn't making something that I felt was impactful at a population health level. So getting to see that impact, we've hit Heartbeat has hit an inflection point. We saw our millionth patient a couple months ago, and we're big enough now that we're really we're really changing a lot of patients' lives and helping a lot of people, and that's impactful for them and remarkably uh, exciting for me to see. Um, and then I think the last thing to say on it is uh, I I did all my training in cardiology and uh, am still an active clinician, and being able to bring a clinical skill set into this world of technology and care delivery and value-based care uh, is I think there's a huge need for that for people to cross the border from clinical into entrepreneurship, innovation. And so I think personally it's very rewarding, but um, I I hope that we see more of this because that cross-disciplinary work is how we're going to make some big changes in front of the status quo.
Based on what you just said, I have another question I want to ask you
Yeah.
because I do get this a lot from all types of clinicians and physicians. There's so many people that are actively practicing but want to make that shift to being on the tech side. They have the clinical experience, and they could provide a lot to, whether it's in an advisory role or it's a co-founder or in a director of like clinical operations, whatever that may be. What is a good first step for those people who have no experience like on the tech side?
Hmm. I love that question. So I'd say the every clinical early stage company needs clinicians. So the easiest first step and the lowest friction first step is to do some research to find companies that are related to your space. If you're a primary care doc or family med or dermatology, every one of those categories has a dozen companies working in it now. And then reach out to the team, find them on LinkedIn. They'll have a website, they'll have an email address you can email and say, hey, I'm a clinician working in your space. I'm interested in your model. Can we set up a meeting? It's as simple as that to then open the door. They will receive that with open arms because believe me, all of these companies need sound clinical minds helping to develop their workflows and product. And then share what your interests are and say, I'm an active clinician. I've never really done anything on the tech side or on the um, startup side, but I have this interest in X, Y, or Z. And it may take a few of those conversations to land it, but there's nothing stopping you from having those. And I can tell you with as honest, face that we probably at least a dozen people on my team now came in that way. They expressed interest, had a cold outreach. I or someone on my team was happy to meet them, and of course they were these brilliant minds that could contribute in a way that was really helpful for us. So that works, and there's nothing stopping you. And yeah, it's a definitely a needed cross path.
Oh, thank you for that advice. I know a lot of people. I hear that more than ever before, and I don't know if that's because they're burnt out in their current setting, right? And they want to be able to use what they've learned over the years on the tech side. I think that's part of it,
Yeah.
but I think if you go up to any type of clinician, I think they would express interest in even in a part-time basis being involved on the tech side as well. Last question, what's next?
So we Heartbeat is uh, in execution phase right now, which means we've hit a really nice level where we've got lots of customers and patients we're seeing by the minute, by the day. Uh, Now, how can we make sure that we are executing really soundly, um, keeping our quality exceptional, and then studying what we're doing? I think that last part from day one, it's been really important for us to bring an evidence base to the table to say this business doesn't just work because we have a business model, but we work because we study the outcomes and the outcomes are great for patients. So that's the mode we're in right now. Execute flawlessly and study what we're doing.
I love it. Well, I'm a fan. I'll be cheering from the sidelines. Look forward to continuing our conversation, hopefully on another episode at some point. But thank you so much for your time here today.
Yeah, thank you, Jared. This was fun.